Bismillah Rahman Rahim. Dignitaries, ladies and gentlemen, Assalamu alaikum. I'll be brief. I'll present the case of Balochistan in the given slot with the situation analysis that what are the factors that are affecting and making the lives of people vulnerable in terms of mental health, and what are the factors that can work in case of Balochistan, and what is the way forward. Starting with the factors, you can see on the slides that these are the things that is worsening the situation in Balochistan, and I say that Balochistan is more stressed as compared to other provinces of Pakistan. You can see on the top the security challenges that we are facing. I'm not going into details of it, you all know this. Only what I can say is that every family in Balochistan now has a story to tell, that how they have been affected directly or indirectly at the hands of terrorists or the law enforcing agencies itself. Talking of economy, though the economy is in the phase of recovery, but yet our figures are not very encouraging. When we talk of economy and its figures, you can see 70% of population is multi-dimensionally poor in Balochistan. And if we see that this is impacting the health indicators as well, because 10% of the revenue of each family is going into health. So same is the situation of the education. When we talk of human capital, you can see it is 0.3. It means this number of fraction of population is in terms of cognitive abilities and physical abilities, they are impaired for their lifetime. If we dive further, you can see these are the livelihood opportunities available in Balochistan. 43% are dependent on daily wages. Our government employment is just 19%, and people are dying for government jobs as it is sustainable and sort of, you can say, lifetime social safety support that there is available to them. Otherwise, our agriculture is shrinking because of the depleting groundwater and the impacts of the global warming. Similarly, we don't have any industrial or services sector. Only transport sector we have, that too is under stress. So these are the things that are adding to the mental stress of the people. Then we see climate change, as I told, and disasters that we have seen in last 14 and 15 years, the earthquakes that we saw, the floods, the flash floods that really impacted people economically. And then we see the severe impact of the climate change. We are facing droughts. Even nowadays, we are in severe drought. Then there is another phenomenon of Afghan refugees. When they came in 80s, they brought guns, they brought drugs, they brought crimes. Even our childhood is attributed while playing with guns in our early ages. But at the same time, we are in a fix, because we have second or third generation of Afghanis, they are now leaving. So the labor force that we had for construction and agriculture and everything, if they are leaving again, our economy will go to even further stress. People will further face this challenge. And secondly, even the real estate of Quetta has collapsed for the last 2-3 years. Even DHA has not been able to construct a single house in the last few years. This is because of this exodus of Afghan refugees. And the last thing, it might be interesting for you that we have a narco economy developing in Balochistan now. It is kind of this seepage that we had from Afghanistan, and the opium that has been harvested in Balochistan is more than what used to be harvested in Afghanistan before. So this has impact on our culture, this has impact on families, our youth is getting addicted to it. So we are on the trade route as well at the same time. These are all the factors that is creating kind of panic. Our borders with Afghanistan have been closed at Chaman and Dalbandin. The fuel that people used to bring from Iran has been closed. So in this panicky situation, people are now looking after the shortcuts. Cultural values, as Minister told, are vanishing from the middle. So I'm not sure this patience that we used to have as a Pakistanis has gone. And this is creating stress upon stress. Now, where it takes us, simple figures, not sophisticated, to understand that in Balochistan, 20% of the population, that means 33 million, needs treatment, needs counseling of psychiatrists. And it is around 3 million. And when we talk of the suicide, this trend is rising in Balochistan, which is maybe seemingly appear something ununderstandable, but this phenomenon is developing there. And the services that we have is in less than 5 districts out of 36 districts. And this is because we have hold the concentration at Quetta and few or 3 more districts because we have medical colleges and teaching hospitals there. The rest of the population we have across Balochistan, which are in far-flung areas which are difficult to reach. So we have to somehow come up with a plan or strategy or mechanism that we have to address. Now, what has happened in the past? I'm just giving you a snapshot that efforts have been made, but those were small in scale and they were made in silos. There was a project in Jafarabad in 21. You can see the beneficiaries. I'm not going into details. Then there was a trauma emergency services after the earthquake in Harnai. Then you can see the relief response in 2022. And then you can see the capacity building with UNFPA and PPHI together. And lastly, it was UNICEF that was running awareness program. Looking at these programs, what are the lessons learned for us? How do we proceed further? We have, it is revealed that we don't have a strategy, a provincial strategy. If we don't have a strategy, we don't have a plan to provide services across the province. And we have a big gap, as I was telling you in the previous slide. So workforce gap is there. And then we have no research in this area. If we have no research, it means we have no information, we have no data to make informed decisions. And then we have the issues of sustainability and scalability of the programs. Now, coming to the program, as Dr. Asma explained very well, for the first time in public sector, we have brought a project which is being conceived and implemented with this vision of the Planning Commission that has been formed at federal level. We have a humble start with 100 million, but this is for 1 year. And then we have a launching planned on 18th of the same month. We are about to launch it with UNIOM. We are going to train people in 2 months, and we will start providing the services. Now, moving ahead, what this intervention is giving us as output, these are the urban centers that we have selected under the PC1. We are starting from these urban centers of the Balochistan. Secondly, as very well explained by Dr. Asma, I'm not going to detail of this web portal that is be facilitating the whole implementation of the program, and this multi-layered referral system that we will be having on this portal. It will have learning management modules on it, as well as 3 apps as explained, and a data generation will start on this portal. This is 4-tier. I'm not going into detail, just you can focus on the number of Hamdard Force 500 and 8 clinician psychologists we are going to hire, at least on these, for these urban centers. Primary healthcare physicians will be trained, those will be identified by health department, and then psychiatrists as master trainers will also be trained. So this is the whole multi-layered hierarchical referral system that you can see in the program. And of course, without robust monitoring, the implementation of any program becomes questionable. And at the same time, you can not analyze that how you go about for course correction and how you plan the scalability or rolling out in future, what are the things that you will be doing. So when I was presenting it before the Chief Minister, he told that if this program becomes a success the next year, he will give me resources as much as we need. So we have to make this a success. We don't have any option. Thank you.